Okay, hi everyone. Welcome to Jodie. Jodie is from Maracay Therapies, based here in Brisbane, and she is a qualified remedial massage therapist. And her clinic is incredible, supporting women through pregnancy, through birth, and beyond. I send a lot of my clients to Jodie, and they all love her. And she's also a lecturer at Pregnancy Massage Australia. So welcome, Jodie.
Cool. Thank you, Dahlas. It's great to be here. Equally loving BodyFabulous as well, and all of the work that you do with the mums that we send and refer together. It's fun.
Yeah, it is fun. It is fun. And on that, we're both pretty passionate about helping women with pelvic girdle pain. We see a lot of women, in fact, the statistics say that 1 in 5 women pretty much during pregnancy end up with pelvic girdle pain. So Jodie is going to dive a little bit deeper into that. And I guess, Jodie, so when a lot of women come to me and they normally complain they've got a bit of lower back pain, and that is often mistaken as pelvic girdle pain. So what are normally the signs and symptoms that you find are part of the bigger pelvic girdle pain and all the names that it comes with?
Oh, I know. And it's so confusing, isn't it? When you Google pelvic girdle pain, you'll get PGP, you'll get PPGP, like there's all of these.
SPD, yeah.
It's so confusing for women as well, because they'll walk in and they'll just have a pain around their hips, their lower back. And what is probably most heartbreaking is the number of mums that we see that either say to themselves or have been told that it's just part and parcel of being pregnant and it will go away after you've had Bob. And so these poor women are walking around with pain and thinking it's just a normal part of pregnancy. And whilst it's common, it actually shouldn't be normalised in pregnancy. Women need to be aware of it and seek help as soon as they can about it as well. So some of the signs that we will often see, mums will come in and they'll say they've got a band of pain around their lower back. They'll say they've got it around that, right down into the pelvis where that triangle bone sort of sits around that sacrum. They'll say they'll have pain out to the side of their hips. They might have pain in their pubic symphysis, which is around that pubic area when they're walking or sitting or standing. There's really common sites that will indicate pelvic girdle pain. And you're right, you really do need to differentiate between, is it just lower back pain coming from the lower back referring down, or is it true pelvic girdle pain? So mums will come in and they'll say, oh, I had this pain suddenly and then it went away, or they might have continuous pain as well around those sites that I just mentioned. So it's and for some women it can be really debilitating as well. So
yeah, I find that too. I find a lot of women also dismiss it because they might get white pain on one side of the hip and that disappears, and then they get pain on the other side of the hip, or then it moves to the pubic bone, or then it moves to the lower back pain. So they just think, oh, that's just the common aches and pains of pregnancy. Or they're told by someone, and I know we've talked about this before, oh, it's just lightning crotch, which is like such a lovely name, which I've never really heard of before. And it's just dismissed again as one of those, like the baby's putting pressure on a nerve down there or something, or it's round ligament pain. So it is quite hard, I guess, when you are doctor Googling to find the information and to narrow down exactly what it is. So how do you personally diagnose it?
I work a lot with physios as well. I really do believe in collaborating with physios and yourself as well, because it's all about combining everything into one treatment, not just doing a band-aid fix. So there's common things that you'll have, like if mums are, if they're lying on their, in pregnancy you can't lie on your back, but if they're lying on the back and lift one leg, they get pain around there. But if they hold their pelvis together and they can do that, that usually indicates a little bit of SPD or sacroiliac joint pain. Things like if they stand up and they try and maybe put a piece of paper on the floor and try and move that with one foot, and try on the other side, seeing if it's both sides or one side that creates that pain. Things like, just even moving your legs apart, if that creates pain in that pubic area as well. So there's some common signs and symptoms that you'll see, and also just even having a look at around the joints and the posture, and seeing if there's a difference that you can see in the height as well. But then working really closely with physios as well to get that real specific treatment and diagnosis for it.
Yeah, my sort of diagnosis is similar. Like I find a lot of ladies, when we do any one-legged exercises, that's very hard. Standing on one hip, jutting out, even just as they hold their toddler or a bag and one-legged and jutting that hip out, rolling in and out of bed, getting in and out of bed is often quite painful, and walking up and down stairs. And I'm the same. I always refer to a physiotherapist to get that really specific diagnosis. And then right. also working with you, because I know your massage really does provide such relief, because I think for a lot of women, when pain happens, the first instinct is to stop and do nothing. And and I mean, and that applies to so many things, stop and do nothing even when you're in birth and labor, and we're going to dive into that later on. But I think stop and do nothing, but there are things you can do, like your massage therapy, and we'll talk about exercise as well. You can still actually move if you do have pelvic girdle pain. So how do you sort of treat pelvic girdle pain or pubic symphysis pain with massage?
It's really having first of all, it's probably having an understanding of what in particular movements are happening for that mum that create the pain, to sort of narrow down, is it one side, is it two sides, is it just doing short walks or long walks, or like you said, standing on one leg. Then really understanding the posture changes that happen with the mum as well, and really just first of all talking with that mum and helping her understand what's happened to her posture and which muscles will be tight, because there's quite a few that we work on depending on where the area of the pain is, but generally it's the whole approach to it all. So definitely working around that lower back, all of the muscles referring down into that glutes, all of the major gluteal muscles, the glute maximus, that big one that everyone uses to walk, the glute medius and piriformis, they're the ones that will rotate that leg outwards, which in pregnancy is really normal anyway, because women have got that waddle gait, so they're always constantly rotating their leg out. But then bringing that leg back in as well, the adductors on that inner thigh are also quite tight. The hamstrings get really tight, as well as the front of the thigh. So from a massage perspective, when you're working with pelvic girdle pain, it's not just working at the site of the pain, it's working everything that's connected into that, what's causing that pain in the first place.
And that's completely my, that holistic approach, that it's not just the side of the pain, everything is connected. So looking at the posture, looking at the way they stand, looking at how they move throughout the day, what you carry, where you're going, you're sitting for long periods in the car, you're sitting at a desk, all of that plays into it. And then, as you say, finding the areas that are basically working in a way, I guess you say, to support and protect that pain area, and they sort of start working a little bit harder, don't they? And so they need a little bit of help. You
would see it as well. They're so overactive. And from an exercise perspective, you're trying to balance it out with the ones that are probably underactive at the same time. I imagine it'd be the same with the posture with exercise, making sure they're in the right posture and not, one leg out or using just one leg at a time, I imagine.
Yeah, completely. Yeah. And I always say to ladies, every day of pregnancy, you wake up with a different body. There's always, your body's changing because the baby's growing. So your posture is changing, and the way you move also needs to change to compensate that. And that's why, I don't, and you're pretty much the same. There's no sort of cookie cutter approach to, every woman's so different, and every baby, the size of the baby is so different as well. That making sure the way they move, and yes, from an exercise perspective, it's working out, sometimes, yes, you can protect the pelvis by strengthening the glutes, but then I find some ladies have such really, really tight glutes. It's not about just strengthening them. It's like, a tight muscle is a weak muscle. So we need to release that muscle. And that's where you come into play too, with the complementary massage therapy, rather than just going ahead and doing a whole lot of glute exercises. That might not be right for every woman. So it is really just, as you say, just working with that person, and also with a physiotherapist to see if there's anything deeper as well. And it's really common. And I guess for most women, it's sort of not to panic if you are diagnosed with pelvic girdle pain or you're feeling that pain, because it is still manageable, and often movement and mobility and massage does help.
Absolutely, because you absolutely hit the nail on the head when you said a lot of mums will feel like they need to stop, and actually stop is probably the worst thing that you can do, because it creates that chronic pain cycle that happens as well. Getting some mobility and movement and strength into it is so important. And you're right, pregnancy changes daily, and even seeing mums between treatments, every massage treatment is different that I'll do for the same mum as well, because she'll present with different things that are happening because her body's changing so much all the time. Yeah, so it's about working with what's in front of you at the time, but having a plan about, you know, progressing that, understanding her changes, so that the exercises you do, or the massage I do, or the physio treatments that they do are effective for where she's at the time.
Completely. I'm the same, you know. That's why I often talk about this. I find it quite funny when people say, oh, here's an exercise program, and here's your first trimester exercises, your second trimester, your third trimester exercises. I'm like, well, you know what, you can't you might be still doing the first trimester exercises in the third trimester. Yes, there are certain things that you can't do. You know, there's a lot of things you can't bend over and do by third trimester, but it's not that simple. It's, you know, some women can do all the exercises throughout, or, you know, if you end up with pelvic girdle pain in the first trimester, that completely changes it. So,
absolutely. Yeah,
it's sort of, there's no one size fits all. And I think that's where, for a lot of women, just also taking away that comparison, that I always say, give yourself a contract of no comparison, because whatever is working for that person may not work for you due to so many reasons. Yeah.
I like that. We're going to take that on board.
Now tell me, Jodie, because I know this is your specialty with labour, and tell me about, because a lot of women, you know, again, pain and fear, and if you've already got pain from pelvic girdle pain and then you're going into labour, what strategies, both physically and mental, do you help women, you know, going into labour and birth with pelvic girdle pain?
Yeah. Having pelvic girdle pain, or just going into labour itself, I think, I do know that a mum going into that in a space and a place where she feels really confident and comfortable with what's happening, is so important. And we talk in the labour training that we do about the fear, tension, pain cycle. So if there's a fear or a panic or a stress about something, whatever that is, your immediate response is to go into fight and flight and tighten everything up. And then that creates more of that discomfort and more pain. So anything we can do to help a mum understand what's happening with her body, and then give her some strategies to release that tension and stress, just means that the labour is so, you know, just so much more efficient, and just is regulated and so much better. So with pelvic girdle pain, most mums definitely, they say vaginal birth is actually the preferred way to deliver with pelvic girdle pain. Now, I say that loosely because there are certain cases where women actually have quite severe pelvic girdle pain, and that may not be an option for them. So you always need to talk with your medical care provider or obstetric care provider to make sure, you know, the right approach is taken for the delivery. But there's no reason why mum can't deliver vaginally if she has got pelvic girdle pain. And in a lot of cases, it actually helps the recovery with the pelvic girdle pain as well. So just talking with the mum, and again, working out specifically for each mum what's going on for her, and how, you know, where she's feeling it and what the severity is. If she's got that pubic symphysis pain, so, okay, let's encourage you not to sit with your legs wide too much during labour, but really get into positions where she's stabilising that pelvis, and utilising massage and different techniques to really support the areas where she's feeling the pain. So I think it's important, not just in labour, but leading into labour with different treatments, you know, with areas that we might massage to help lengthen the muscles before she goes into labour, will really help her get into position. So any positions, I think, that can support the stability of that pelvis without a fear of there being any pain, because there's so many things that you can do to help a mum go into different positions to just reduce the discomfort that she's got.
Yeah, completely. Because I guess, and I think, I mean, Jodie and I will talk about this a little bit later about birth, but like what I said, a tight muscle is the last thing you want during birth. And tension comes physically and mentally, and of course it's transferred into your muscles, and really the only muscles you want contracting is your uterus and everything else to be open to allow that baby out. So, you know, any fear you have, it's just so important that you just sort of don't go in there and think, oh well, someone told me pelvic girdle pain is just going to completely disappear after birth. It might, or it might not, and it might, you know, depending on what you do or how your birth unfolds, you need to give yourself the best you know, strategy possible, that you're going to go in there confident and supported. And, you know, Jodie specialises in massage and also partner massage to help you have that, you know, as you call it, the birth bubble, to fully support you. Now, Jodie, tell us, like what I just touched on, pelvic girdle pain postnatally. Do you find a lot of women struggle with it post-birth, or you know, it just disappears once that baby's gone and that pressure's gone on the hips?
So yeah, this I guess is where that fallacy comes in, that it is related to pregnancy and it all just disappear after birth. In 90% of cases it does dissipate. I won't say disappears, but it'll dissipate within 3 months after giving birth. So for most women it will be alleviated and she won't feel the discomfort. It doesn't mean that she shouldn't work on it though. I still encourage mums to make sure they have that follow-up physio treatment, follow-up massage postnatally, and also really, as soon as they're able to, get back into some exercise, some really good functional core stability exercise, because there's so much change that's happened in that pregnancy and through labour that it's not, even if the pain's gone, there's still, you know, maybe a weakness in some areas. So whilst, yes, most mums, it will disappear, there is that certain percentage of mums where there is that ongoing pelvic girdle pain. And you also then flip into mums who will have pain around the pelvis postnatally, who may or may not have had pelvic girdle pain in pregnancy. And is it pelvic girdle pain, or is it just related to posture of having a new baby and having to lift or breastfeed or bottle feed? Or so it's quite an easy one to say, oh, you've got pelvic girdle pain, but it may not necessarily just be that as well postnatally.
Yeah, I find that as well. A lot of it does dissipate, but they can be prone to it flaring up again because of the relaxants still in their system, which doesn't just also instantly disappear. It dissipates, as you say, and you know, which can still trigger that pain because of, you know, the relaxant in the system and its inflamed ligaments around the pelvis. And they're moving again into different positions of their body while they're still trying to heal post-birth. So it is important to be really cautious. And as you say, follow up with your physio, be aware of your posture, be aware of your positioning. And again, when you're ready, not jump back into, you know, exercise at that 6-week mark that says tick, you're cleared to exercise, but just be aware that it's a progressive path. Because then it can happen all again.
That's it. And do you find that with mums do you have mums who tried some other exercise program and then it be flared up? Have you got a bit of a strategy in terms of that transition of a mum?
Yeah, I actually find more of them, things flare up probably more around the 4 to 6 month mark, because that's when they think, I'm back, I'm going to go and join the boot camp, I'm going to go and just jump on Google and do the first exercise I see. And, you know, they're feeling good. And I think that a lot of that comes from, I'm finally feeling more like myself mentally and physically. You know, let me do something. But just being aware in the back of your mind that, you know, I always say, if you had a sprained ankle, you wouldn't suddenly go out and the first exercise you do is go for a 5K run. You know, you've got to kind of work within that, you know, that rehab phase. Otherwise, it's just, I always say, you know, an injury can be temporary. You don't want it to be long term. So you want to make sure it's a temporary injury and not keep coming back, because and more women are more prone to pelvic girdle pain in second pregnancy and third pregnancy. So really staying on top of it is really important.
Yeah, definitely. I think I definitely had it in my third pregnancy. I remember saying to my husband, I feel like my pelvis just fell apart like at 12 weeks. And the bands, those, we didn't touch on it, but making use of the supportive bands.
Oh yeah, the supportive bands and belts. Yeah, that's a good point.
They might seem like they don't do much, but they just provide so much stability around that pelvis and can allow mum to do exercise more and be able to move a little bit more. Yeah,
I often refer ladies to a physio to go and actually get properly fitted with those bands, because they are so supportive, and again important as well if they do have that pre-existing condition, to wear it post-pregnancy as well, just to bring some awareness that they might be feeling okay, but then you're so busy with the baby and everything as well, you tend to put yourself last. So just sort of a little reminder that everything isn't quite there yet makes a big difference, and just allowing your body to heal. Time is really important.
Gosh, your body's, it's done its biggest job for 9 months of pregnancy, and then run a marathon in labour. And then it's, moving and changing and having to bend over into a cot and breastfeed or bottle feed, or just move as a mum and cope with the changes for that. It's just, a woman's body is incredible, and it's done so much change, and anything you can do to support it. If you've got pain, you have to get it seen to straight away. Don't wait. I see a lot of mums will come in at 38 weeks and go, oh, I've got this pain, it'll go away. And I still encourage them to go to the physio before Bob's, due, before labour starts, because there's so much that can be done just in that short window to just help them.
Oh, so much. And I know, because I know everyone who goes and sees you, and including myself, if I go have a massage from Jodie, it's like, why didn't I do this sooner? I realise now how much I need it. That's probably, you need to have that written on your door.
That's pretty common, yeah. And I think that's probably that's why we specialise in pregnancy massage, and that's why I now lecture with Pregnancy Massage Australia. All of my therapists have been trained specifically with pregnancy and positions and table setup and techniques for. What we do is not just a fluffy massage. It's specific techniques to really help support a mum and make significant change to what discomfort she might be feeling. Yeah,
that's so important. So on that note, Jodie, where can everyone find you? Where can we find out more about Marakai Therapists?
We're located in Hawthorne, just over near Blimba, Balmoral little pocket. So we've book online. We're here 6 days a week with 2 rooms available. Pregnancy, postnatal, fertility.
And what's your website?
marakaitherapies.com.au.
Great, and we'll put a link in for that as well. So thanks, Jodie. Thank you for your time.
You're welcome. It was great to chat with you, Dahlas.
You too. Take care.